All right. Greetings, everybody. Welcome. It's noon here on the East Coast. You are here for a briefing on from the HHS executive leadership about opportunities on AI technology and data. Welcome. My name is Steve Posnack. I'm going to introduce our full team in just a minute, and we can go on to the next slide. We have a number of representatives from our executive leadership at HHS, both from our Assistant Secretary for Technology Policy Office, as well as leadership from our Deputy Secretary's office as well, and our human capital specialists from our team too. I know people are rolling in as we speak, probably transitioning from other meetings. So I'm also buying you all a little bit of time to perhaps grab a drink, grab a bite to eat, and buckle up for a jam-packed education session on executive level, senior executive service positions that we're going to be discussing. So these presenters will make magical appearances by virtue of the internet on the screen today. You can see their titles and where they live within HHS, and we'll let them introduce themselves as well. I humbly serve there as the Principal Deputy Assistant Secretary for Technology Policy as well on the slide, and we'll go over to the next one just to orient everybody to a bit of the lay of the land and the landscape of what we're going to talk about today. Data and technology policy operations have grown significantly in recent years as core functions of HHS for HHS. And as a result, HHS recently completed a reorganization to streamline and strengthen our technology, data, and artificial intelligence strategy and policy functions. This reorganization will help ensure that we're keeping pace and meeting mission demands well into the future. So in short, oversight over technology, data, and AI policy and strategy is now consolidated into this new Office of the Assistant Secretary for Technology Policy, which also includes existing and current responsibilities of the Office of the National Coordinator for Health IT. And so you see some duly titled roles and responsibilities. But what we are here to talk to you about today is not one, not two, but three exciting new leadership opportunities for you to have a chance to fill an HHS-wide position that will provide executive direction either as the Chief Technology Officer, the Chief Data Officer, or Chief Artificial Intelligence Officer for HHS. And as you can see on the brief org chart that flashed in the prior slide, the Chief Data Officer and Chief AI Officer will report up through the CTO. All three of those, the trifecta of positions, are currently open and available. And we're going to give you a bit more detail on those and hopefully answer a few questions. So with that, I will be turning it over to our Assistant Secretary for Technology Policy, Mickey Tripathi. Take it away, Mickey.
Okay, great. Thanks so much, Steve. And thank you to everyone for joining. Really excited to be here today. Really excited. There's so much interest in this. I'm Mickey Tripathi, Assistant Secretary for Technology Policy and National Coordinator for Health IT. Let me give you a little bit of background of the motivation for this reorganization and the establishment of these critical offices under the Assistant Secretary for Technology Policy. This is really the coming together of two very important threads within the department and that reflect threads that are in the industry at large. First is meeting the moment. As we think about the advances in data, the advances in technology that the industry is going through, and in particular in healthcare, over the last 10 years, and a role that that the Office of the National Coordinator has been playing, we've had a tremendous transformation of the healthcare delivery system from a paper-based system, especially among hospitals and physician offices. Short 10 to 12 years ago, something like 10% of provider organizations, for example, using electronic health records, to the point where now you've got 97% of hospitals, over 80% of ambulatory providers using certified electronic health record systems that are certified by the Office of the National Coordinator. That's a tremendous and rapid change in a relatively short period of time, and has put us in the position now where, as a country, we have this digital foundation as we think about healthcare. And what that's done is across the department, think about the kind of the spectrum or the continuum of life sciences and healthcare that the department covers, everything from medical research and discovery to medical product development, and regulatory approvals to healthcare delivery, to human services delivery, to population health, and kind of everything in between are areas that the department and our operating divisions actively work in, actively participate in the market, actively have regulatory authorities in, and actively have funding programs in all of those areas. And with the the advance of information technology in general, and certainly with the big boost through the programs that accelerated the adoption of health information technology and electronic health records in the healthcare delivery system, what we've seen is a veritable explosion in the uses and the opportunities for the uses of these technologies for the advancement of almost every mission area across the Department of Health and Human Services. So that's been a trend that's been happening over the last few years. And excuse me. And as we've been working across, across the department, we've been, working more and more around the alignment of these different initiatives from our agency partners in the ways of making best use of those technologies that are now available and that are there for us to be able to take advantage of from a program and mission perspective to better perform those missions in a more cost-effective manner and with greater synergies across the different operating divisions, across the different mission areas to better accomplish our missions overall for the American people. About 2 years ago, the Secretary put into place a policy called the Health IT Alignment Policy, which had ONC, National Coordinator's Office, this office, working more actively with our operating division partners to get better alignment in the use of health information technology, adopting the core standards that we've required in regulation, for example, adopting the same standards as it relates to interoperability and the use of things like FHIR API, for example. So we'd already started down this path of saying that the technology and information technology in particular is more and more not an administrative thing that is something that is sort of secondary to the mission activities of each of our operating divisions and as the department as a whole, but more and more is a critical strategic arm of the way that we actually conduct business across all of our operating divisions across these missions. And similar trends happen obviously and have been happening for a number of years in the private sector, and we're now doing that in the department itself to start to really elevate sort of the importance and the strategic importance in particular of information technology and the various different dimensions of information technology as a fundamental strategic lever that we need to be thinking about that's critical to our performance across all of our mission areas that are under the Department of Health and Human Services banner. So that's kind of one trend that's already been underway within the department is sort of the bringing those technologies more and more to the forefront. The second, as I described, is about ONC's role at the health information technology lever, and now being able to say, how do you bring those together? The next evolution, the next step in thinking about that as a strategic imperative is to say, how do you bring together the mission orientation from a policy perspective of what are the key policies, what are the key mission areas and objectives that we have in our operating divisions, in our staff divisions, and as a department of it as a whole, and how do you bring that together with the important capabilities that information technology can bring to bear to be able to better perform those missions overall. So it's really, as I said, the bringing together of the need at a department level increasingly to be able to identify department-wide initiatives that we need to be able to do, both at the department level as well as cross-agency. How do we think about the better coordination and collaboration across our HHS agency partners as they increasingly start to use technology, start to invest in technologies, and we want to make sure that those are aligned, that that to the extent there are gaps there, that we want to make sure those are filled, to the extent that there are opportunities for synergy to make sure that that, as the Deputy Secretary likes to say, that this department is greater than the sum of its parts. That we've got a lot of activities going on here. We need to make sure that we are taking advantage of every lever that we have to make sure that working together, we're doing the best that we can possibly do. And technology is critical to that. So that is the excitement of the work that we have ahead of us now with these three key roles that we want to be able to put in place. The Chief Technology Officer role is really the umbrella, the overarching role for the under ASTP to be able to provide that technology perspective from a strategic and mission perspective overall in the uses of technology across across all of our various operating and staff divisions and at the department level. How do we think about the strategic uses of technology? How do we think about where technology is headed? How do we think about the bringing innovations to bear in department activities, both internal to the department as well as in our mission-related activities across our operating and staff divisions to make best possible use of that to decide which ones are ready for prime time in terms of the capabilities and the capacities that we want to be able to develop at the department. And then how do we work with our partners in the Office of CIO, for example, to make that a reality in terms of things that we actually deploy and make available across the department. So that's a critical role, working in close partnership, obviously, with the CIO's office as we think about things that are about innovation, things that are about mission orientation, and then how you have the handoff to things that end up becoming a part of what's available as an enterprise function in our day-to-day footprint that HSS employees and HSS internal operations use every single day. Again, very similar to to any private sector company that is thinking in the same way of you've got your internal operations related to CIO capabilities, related to the technologies that are used for the enterprise itself, as well as the technologies that are used for the mission, for the product, and those being, sort of different but complementary skill sets that have to work very closely together. This is about instantiating that CTO function from the mission or orientation perspective, and then making sure that that is, sort of getting the dedicated resources and the attention and the visibility and the authority that it needs to be able to make sure that that's genuinely a strategic, lever that we're able to exercise across all of our department activities. So the CTO provides that overarching perspective. The Chief AI Officer, very important role. Obviously, AI has helped to even further push and further fuel that trend that I was talking about in general. We've already been on this path with information technology and all of its various dimensions, and data being a part of that as well. All of the advances that we've been seeing are very rapid advances we've been seeing just in the last couple of years with artificial intelligence and the uses that it, sort of, and the potential that it has across every single domain that the department covers is the opportunity and giving further fuel to the need to have this, more strategic perspective front and center in our department decision making. So the Chief AI Officer role is really got at a high level, and we'll dive down with a little bit deeper discussion in each of those areas in a second. But driving department-wide activities in research and development, in the vision, strategy, and execution. So it's really about coordinating and identifying areas for further research, for further advancement, and working with our operating and staff division partners on accelerating those activities and aligning those activities. Second is about leading that strategic direction and initiatives within the department itself. How do we make sure that we've got the visibility that we need into all the various activities as more and more effort and energy gets generated in the operating staff divisions? How do we make sure that that's aligned and addressing the strategic need? And that's that third bullet, is collaborating with our operating and staff division partners. Finally, the Chief Data Officer is a role that has existed. We want to be able to make sure that that is more fully integrated from a strategic perspective as we think about the interplay between technology at large, AI, and data, and how all of those come together from a thinking about the mission of the Department of Health and Human Services, the strategic goals that we have across all of the mission areas, and the ability to make the most effective use of all of these technologies in a more integrated fashion to be able to support the mission activities of our operating divisions. So let me now turn it over to my colleagues, Aaron Zellman and Sarah Esty, for a little bit more of a deep dive into each of these roles. Thank you.
Thanks, Mickey. This is Sarah Esty. I am the Senior Advisor for Technology and Delivery at the department. And if we can, as you see, I'll be talking about our Chief Technology Officer role as well as our Chief Data Officer role. So as Mickey mentioned, the CTO will be setting the vision for technology innovation at HHS. This role oversees our Chief Data Office and our Chief AI Office, and is also going to be building out a new digital services delivery area. HHS had previously had a CTO who was a standalone role. That role went away for a couple of years, and so we have reinstituted this position, but with a bigger set of responsibilities under it. But it is also going to certainly be an area of continued growth. So somebody who is eager to help set a vision for a new area, who is a collaborative team player who's going to work with our data and AI leaders and across the department, as well as building out and helping work with us to resource and staff a digital services team would be a good fit for this role. So writ large, the CTO will be supporting successful design and delivery of key technology initiatives throughout the department. So if our CIO team is running our enterprise backbone tech, the CTO is doing the projects with subcomponents of the department, helping them deliver on their mission, as well as the special projects that might be cross-cutting, urgent fires or big priorities that are too big for one single team to handle successfully, where maybe they need an expert consult or some help. This person is also going to help drive awareness and adoption of technology best practices. So should be somebody who's strong in agile and human-centered design, and can help think about how do you bring that personally as a consultant to teams, and how do you help build that culture across all of our teams? How do you help connect our technology teams to each other and to the ASTP team? This person will also help coordinate technology policy and strategy issues. So we'll be representing HHS on interagency efforts or pulling together the relevant groups of people across HHS to deal with emerging topics. Maybe that could be some of our AI adjacent things. It could be things like digital identity. It could be topics like how we're evaluating the impact of algorithms on equity. So those types of things that are embedded in how we do everyday work, but require more of a coordinated approach. And then this will also be someone who is able to look across the landscape and see what opportunities are coming down the pike and what challenges do we need to get out ahead. So we're not in a reactive posture, but are leaning in and getting ready for what is to come. So we want somebody who's coming with significant technology expertise, but also with a background and facility in things like governance, policy, strategy, team leadership, and being able to coordinate and use soft power in addition to working with the teams that are directly under their leadership. And then I'm going to pass to my colleague, Erin, to take us through the Chief AI Officer.
Thanks, Sarah. So apologies if any of this is repetitive, but as many of you know, HHS's mission is to enhance the health and well-being of all Americans by supporting effective health and services. And so part of that requires the fostering of sound, sustained advances in the sciences underlying medicine, public health, and social services. And that's how we're looking at AI through that same mission lens. How do we advance responsible use of AI to improve people's lives? So here at the department, we're AI optimists. AI technologies have the potential to drive innovation, increase market competition, advance health equity, and improve care and the care experience for patients. But we also believe that our approach to AI in healthcare should be don't trust without verifying, and that it's our duty to Americans to have protections in critical fields such as healthcare, human services, and public health. So HHS's engagement with AI to date includes regulatory and educational actions involving the effectiveness and safety of AI-enabled medical devices, biomedical research applications, transparency and risk management of clinical decision support tools, non-discrimination, and improved research processes. Part of the reason I'm explaining all this is because these activities are happening across the entire department, and the creation of the Office of the Chief AI Officer reinforces the additional resources, leadership, and coordination needed to ensure that we are meeting the moment. So it's an incredibly exciting time to be working on AI in the health and human services space. And the chief AI officer will really get to hit the ground running. The CIO will be responsible for building out capacity in ASTP, identify, incubate, and scale AI-based technologies throughout HHS, ensure we have the right mechanisms in place to mitigate risk and make responsible decisions, and to engage with industry to navigate HHS's approach towards AI in health and human services. So we're looking for many of the similar qualities as Sarah mentioned and Mickey mentioned earlier. So collaborative team player, strategic thinker, to make sure HHS is coordinating across the department. And like I said, really meeting the moment when it comes to artificial intelligence, someone who can navigate a large organization. There's a lot going on in different operating divisions at HHS, but we're really thrilled that we'll now have this node in the department to do that coordinated and strategic thinking, to set AI policy and strategy for the department, to do the internal governance work that I've mentioned, and to overall make sure we're investing appropriately in AI and supporting the safe and appropriate use of AI technologies and tools across the department and also across the sector. With that, I will kick it back to Sarah.
Thanks, Erin. And so I'm going to share a little bit about our Chief Data Officer role. So this position is overseeing a small team, and there are also several roles I will be looking to fill. So you'll be helping both nurture and grow this area. This is a relatively new office. So HHS obviously has very robust data capacities across our divisions, but has only historically had a small central team. And so you will be thinking about how we approach data from an enterprise perspective and how we help make sure data is available and being used in each of our divisions and externally to deliver on HHS's mission of supporting the health and well-being of all Americans. So this will look like facilitating appropriate and legal data access and sharing, building the data skills and data-driven decision-making approaches throughout the department, driving cross-division data projects, so thinking about teams that might need to work together on particular approaches, making sure we have the right policies in place for things like consistency of data standards or taxonomies, as well as looking ahead to innovations and getting folks ready for those. It also includes establishing and maintaining effective data governance, accessibility, and other requirements. So this should be someone who is ready to be a leader and set a vision and approach, as well as being a subject matter expert on data issues for the department as a whole and for individual teams. It should be also someone who can come with policy expertise, with thinking as somebody does on governance, on systems. So we need someone who can both be an analytics doer, but also really that bigger picture strategic perspective on data, and who's able to do external landscape, looking ahead to what's coming, while also making sure that we're helping each of our areas meet their current missions. And then, as I talked about, that management of being able to build and scale our current team and working together. So working with all of the chief data officers for each of the HHS subcomponents, working with other chief data officers across government, being able to represent the department and our interests in data topics, and being able to get consensus or at least get all of the perspectives understood and heard as we make important decisions. And so now I'm going to pass over to Lisa to tell a little bit more about the requirements for these roles and some of the process to actually apply.
Thank you so much, Sarah. Good afternoon. I am Lisa Lewis-Person. I am the Deputy Assistant Secretary for Technology Policy. I want to speak with you first, just to let you know that having the opportunity to be a member of the Senior Executive Service is one of the highest honors in government, and in my opinion, that you can have, period. We serve as the highest level career leaders in the federal government. We are responsible for serving the American people every day at the highest levels through presidential transitions of administration and ensuring that all goals and objectives are met through the administration that is in power. What I would also like to tell you is that our vision within ASTP is better health enabled by data. And we work every day to make that a reality. And so we are recruiting the best of the best for these positions because we are the best of the best. So what do you need to know when you're applying? I want to cover some things to help you make sure your resume translates and that you make it past the first level of review. And so on this slide are the executive core qualifications, and you must display that you have this experience in order to make it past the initial review. So translate your resume into a format that clearly articulates what you have done to lead change, to lead people, to have outcomes that are results driven and that show impact, that you have experience in business, that you have led organizations, and that you have been able to build coalitions. And so some examples in leading change, show that you have led organizational change or that you've implemented new systems or technology across an enterprise. Leading people, you want to show that you have actually led teams, that you've either established or led teams to achieve successful outcomes. Results driven, what are the major achievements of your career and how can you articulate what your role was in achieving that outcome and what the impact of that outcome was? Business acumen, again, show that you know how to manage budgets, manage people, manage organizations, set strategic vision, and are a leader, a proven leader. Building coalitions, have you led task forces? What have you done that actually required you to bring people together to achieve an outcome? Make sure that is very clear in your resume and that you clearly articulate what your role has been to achieve those outcomes. And then finally, please be sure to make sure you address the technical qualifications. And my assumption is that you would not be on this call or this webinar if you could not meet the technical qualifications. And so just make sure that's clearly laid out. My colleague who will follow me, Nina Oft, will go into more specifics on the logistics, but I want to thank you for your interest in our positions. And I do hope that you will apply and become part of the ASTP team. Thank you so much. And I'll pass to Nina at this point.
Good afternoon, everyone. Thank you, Lisa, for providing that overview. I just want to provide some helpful tips on the application process. And my name is Nina Oaf. I should have said that first. I am the Senior Advisor for the Human Capital Branch within ASTP ONC. And we are excited that you are here today to hear all about our new opportunities in the Senior Executive Service. Some helpful hints when applying to the positions. One thing that you want to note is that you meet all the resume requirements. In the announcement, it asks for you to make sure that you clearly address the mandatory technical qualifications in your resume. You want to make sure that your resume does not exceed 5 pages, and it is should be a federal style resume. You want to make sure also that if you have any supporting documentation, if you are a current or former federal employee, you want to make sure that you submit your SF-50 so that we can have that in review of the application process. Also, if you have any OPM Qualifications Review Board certification, you want to make sure that you submit that certification to ensure that the requirement for the ECQs are met. Also, as mentioned previously in the prior slide by Lisa, that the executive core qualifications should also be considered. You should prepare yourself to write those ECQs. And we have included in the chat a document that will help you strategize how to develop those ECQs in preparation. Those will be required as a part of the submission when you go through your interview process. And so you want to make sure that you take a look at that document, make sure that you have prepared yourself, and make sure also that your resume is clearly addressing some of those ECQs as well. Also, you want to make sure in preparation for the interview process that you have your body of work available. So if you have a portfolio with your body of work, you want to make sure that you have that in preparation for the interview process, as well as any references. You want to make sure that you have those prepared in advance. So if you need to contact prior supervisors or prior colleagues that may assist you in this review process, you want to make sure that they are prepared and also are aware that they would be contacted, as well as have any email information and telephone information as well. You also want to make sure that you anticipate at least a 90-day process from the close of the vacancy announcement. And we can move on to the next slide. We're going to talk a little bit about the next steps. In the chat, you should have also seen twice the vacancy announcement job opportunities listed there on USA Jobs. We also provided some helpful resources on the Senior Executive Service. So your information, if you want to know a little bit more about SES and are not quite sure or not aware of all the requirements, not sure about the ECQs, we did provide some resources. So the next steps, we're right now at the JOA, the job opportunity announcement. So you are here. The announcement is currently open until August 9th. So you have a little over a week left. If you have not started on your application, you have a little over a week left to do that. Then the next steps after the announcement closes is the agency panel review of candidates. That starts on August the 22nd. And then we have the interview process that will start September 15th through September 27th. Then our selection process will start around October 1st. We expect that we would have a selection around that time. And I should point out that these dates are TBD. We are in the process of working the schedule. However, depending on things like federal holidays that we have coming up, there may be some deviation in the schedule by a hair. Our tentative job offers are expected to go out October 15th. And I just talked a little bit about the qualifications review board. That process will start October 23rd. Following the QRB, the agency, we will get the candidate certification to the SES position, and then the selectees will be onboarded. So we are going to start this next part of the presentation with Q&As. I believe I have a couple Q&As that questions that have been asked in the chat. I want to make sure that for those of you all who do have questions, to make sure that you please add them in the Q&A in the chat, and we will be taking those questions. And so the first question that I have is, will we share the presentation slides? We will be sharing the recording of the presentations, so you will get access to the information, all of the information that's been presented today. There was a question in the chat about, does it hurt my chances if I do not reside in the DMV area, but am considering relocating? Does it hurt my chances? It does not. Living outside of the DC local area does not hurt your chances. So we welcome anyone who is outside of the DC area or inside of the DC area to please apply. Can I apply to multiple positions? Yes, you may apply to multiple positions. Any that you meet the qualifications for, yes, you can do that. The CAIO position, is it supervisory? Yes, there is a team that you would be supervising, and the structure is set up in such a way that we have the CAIO office, and then we have two branches that cascade underneath those, the CAIO. So yes, you would be supervising for that position. There also was a question about the remote flexibilities. The CAIO position, the Chief Artificial Intelligence Officer position, is remote, and the Chief Data Officer and Chief Technology Officer positions have remote flexibilities after consideration after 90 days. And so what that means is that initially those positions are considered telework eligible. Pending the 90-day completion, then that would be something that ASTP ONC would discuss or decide afterwards. So we'll open up for the next set of questions.
And we did see people raising their hands. We don't have a way to unmute you. So if you do have a question, please do put it in the chat and we are happy to read it aloud for you.
And this is Mickey. Let me just, while people are formulating the next set of questions, I saw a question related to how much of this is about influence versus, having a full team. I think that's an important thing for anyone who's applying for any of these roles to consider. That there's the balance of influence and authority. And, we operate at the secretary's level, at the Department of Health and Human Services level. So we collaborate and coordinate a lot. So our national coordinator origin, I think, is still very prominent in this role, in the ASTP role, and certainly for these three offices. That coordination function is very important. There's a lot of collaboration activities that go on across the operating and staff divisions. There's a lot of alignment. So a lot of this is going to be about playing that role and being comfortable in playing that role of collaboration, working directly with our agency partners, working directly on alignment of different activities, working directly on connecting dots. So for any who are, thinking perhaps like in the chief AI officer role that, you'll be sitting in a room designing models and having access to huge data sets and developing the next generation models, this is probably not the right role if that's really what you're targeting. This is much more at one level above, which is to say, where do we need those kinds of activities, and where do we need the applications coming out of those kinds of activities, and how do we work with our operating and staff division partners on enabling those activities and aligning those. Hopefully that's helpful.
There are a number of questions in the chat. One of them was, how will we be conducting the interviews? The interviews will be virtual. So if you make it through the various rounds and you are part of our group that we can choose to interview, we will be conducting those virtually.
Equally, there's another related to whether or not the teams are fully staffed under each of the positions. The answer is no. And as Sarah mentioned earlier, you'll have an opportunity to help grow the teams and advocate for additional resources, as being necessary for mission-related responsibilities.
There's a question in the chat about gaps in employment, and we do understand that there are times where personal things require gaps in employment, so that is not looked upon negatively.
I see some technical questions in the chat. Is there a page limit for the resume? Yes, you do need it to be 5 pages or less. There was a question about whether you could apply to multiple postings. The answer is yes, just submit 3 different applications. We have a question about whether only current federal employees can apply. No, you do not need to currently be a federal employee, and you do not need to have already completed the SES training and qualification process. We will be doing a resume-based review to determine SES qualifications. So it's very important you include all of your experience, but you do not need to already be within the GS system to qualify.
I saw a couple of other questions. One was about, are we going to be doing these sequentially, starting with CTO, CAO, CDO? We are doing these in parallel. In an ideal world, we might have built that incrementally and established it over time. We are doing everything we can to meet the need, and we're meeting the need at the moment. So we are doing these in parallel. We want to get these critical roles in place as soon as we possibly can. I saw another question related to what's the balance between leadership collaboration skills and technical skills. The answer is absolutely both. You absolutely need the leadership collaboration skills, but you need enough of the technical skills to be able to help to identify what are the key areas in each of these areas. How does that apply to the policy priorities and the mission objectives that we have? And then how do we turn that into department level priorities, department level programs to be able to, best perform the missions that are under the Department of Human Services?
There were questions in regard to, can we discuss budget and number of staff? We will share that information with those who make it to the interview stage. So apply. And just know that it's an exciting opportunity and an opportunity to really build out these offices and to have a huge impact across HHS. And again, in service to the American people in a way that you don't have the opportunity if you are not part of the senior executive service in federal government. And then there was another question in regard to, are the ECQs a separate document or part of the resume? They have to be built into your 5-page resume. Just so that we can see that you have that experience and you can make it through the different levels of review. And then it goes from there to OPM, where you will provide more information.
There was a question about the salary. The starting salary is $147,649 to the high of $221,900.
I think we got a question about the questionnaire assessment asking if you'll have 1 year in time at grade 15 by the closing date, and how folks coming from outside the federal system should respond to that. Nina, could you maybe speak to that?
Yes, you are required to have 1 year of experience equivalent to the GS 15 level. What that means for individuals who are outside of the federal government, it just has to be equivalent. So the experience should be similar in level of leadership at the GS 15 to qualify for the SES.
I saw a question about the relationship with the Office of the Chief Information Officer, the CIO's office. This will be very much a complementary activity. And the CIO's office performs critical functions related to the enterprise footprint of technology that we have across the department, and will continue to play that role. And I think, as all of you appreciate, that role is getting more and more vital as we think about cybersecurity and the hardening that all of us need to have in our enterprise systems. So that role will continue. This role is really about the innovation side, about the mission delivery side of the uses of technology as it relates to the strategic imperatives of the department itself. So to the extent that there are things that are identified from an innovation perspective, from a mission perspective, that eventually work their way into the enterprise footprint of the department, there would be, a handoff or a complementary, kind of relationship there with the CIO's office. So both performing critical functions, both performing critical functions, but very much, sort of making sure that we have dedicated resources in each of those critical areas. The other thing that I'll just note with respect to everything we're doing here with the CTO, the CDO, and the Chief AI Officer is that critical to the performance of those roles is the policy perspective, is an deep understanding of the mission objectives of the department and all of our operating and staff divisions, the industry that each of those agencies works critically with, and an understanding of how do those policy priorities turn into mission objectives that are accomplished through the exercise of the levers that are available to us. Everything from education and outreach to regulations to budget to our internal operations and infrastructure. All of those things, and thinking about how we orchestrate those with a very specific integration of the policy dimension of that, to be able to then think about that from a strategic perspective. That's where it's a little bit different, and I think that's where the the leveraging of the capability that ONC already had in place, because of all the work that we did and continue to do in health information technology. We already had a very strong technical group and a very strong policy group and regulatory affairs group. So this is the opportunity to say, if we consolidate these other strategic technology components on the chassis that we've already built for health information technology, we're able to leverage those capabilities in a matrix fashion to be able to make best use of the skills and the capabilities that are already in place, to be able to extend those out to all of the technology areas, not just electronic health records and clinical information systems.
So we got a question about the scope of the focus for the CTO having in previous iterations be more externally focused. It sounds like it's more internally focused. That is correct. And we see a lot of the external engagement coming in maybe more under the chief AI officer or in the division-specific relationships with industry, and the CTO at present is more focused on internal operations. But I think with someone coming in to this new role, there will be an opportunity to continue shaping the focus areas. And then there was another question confirming these roles are for HHS wide. And yes, these are all HHS wide roles. They cover both health and human services. And they are working with the folks across the department who serve as a CTO inside a division, a CDO inside a division, a chief AI officer inside a division. We also got a question about whether if somebody's maybe saying these leadership roles are not for me, but I'd be very interested in joining some of these teams, where would I find more information? So the ASTP website will have postings for any future opportunities. So we can drop that link in the chat, and you should definitely kind of keep checking back at least once a week as new jobs might be posted there. You can also set up USA Jobs to send you hiring alerts around some of our key terms and ASTP. So you'll want to do that too.
There were a couple of questions surrounding veterans preference. These positions are open to the public, and veterans preference does not apply to these positions. We had a couple of questions also about does state government also, is it applicable to these announcements? And yes, so while the position does, the job opportunity announcement says federal and corporate, that also includes state government as well. So if you are at state government and meet the eligibility requirements, please apply. There was also a question about citizenship. So the position is for U.S. citizens and those who have national allegiance. So that's America Samoa and Swain Islands. So the position is primarily here for U.S. citizens other than those who have national allegiance to the U.S. And that's America Samoa and Swain Island. There was also a question about if a candidate makes the interview stage, is there a coach available to review ECQs before submitting them to OPM? And yes, we do have assistants that can provide us with, provide you all with some assistance in writing the ECQs. We did provide a document that's included in the chat also on how to write your ECQs. It is from our SME on writing ECQ. So if you would take a look at that document and download that, please. There was also a question about what type of security clearance is needed, and that is the top secret, sensitive, compartmented information. So top secret clearance for these positions.
We should also clarify for security clearance, you don't already need to possess the security clearance. We would work with you once you are selected to go through that process. But you should be capable of making it through the process.
That was what I was going to add. Thank you, Sarah.
I see a question on team dynamics and the collaboration process between the technology AI department and other departments within the organization. Depending on what you mean by organization, let me start with ONC Classic, or the Assistant Secretary for Technology Policy. This is, as the org chart showed, we've got 3 existing divisions. Operations, which is headed by Lisa Lewis. We've got Standard Certification and Analysis, headed by Avinash Shanbag, and we have the Office for Policy, headed by Elise Anthony. Those are 3 existing divisions already within the department. the reorganization has now created a new division, the Office of the Chief Technology Officer, which is what we're talking about here in the 3 senior positions under there. But ONC historically, and we will continue to do this, is very much matrixed. So there are key functions, key priority areas, as we're discussing. There is certainly a department level kind of focus with these 3 roles, the CTO, CAO, CDO. But in general, being able to draw from the teams that we have in place in a very collaborative and matrix manner, I think is the opportunity for us to make the best use of the skill sets that we have and make sure that we're looking at this in an integrated fashion as the existing teams from on the ONC part of the original ONC part of the organization have been working across all of our operating staff divisions, for a number of years. So we want to be able to leverage those relationships, those capabilities, the kind of infrastructure that we already have in place to be able to manage those relationships and make sure that the CTO, CIO, CDO can hit the ground running and make best use of that chassis, as I said, that we've already got in place.
Nina, I think there were a couple of questions for you in regard to coaches to help with ECQs. What I will say is for the final selected candidate, we do have assistance, but only for the candidate that is selected for the position. And then, yes, we can confirm again that ECQs are to be part of the 5-page resume. And with that, I'll turn it, Nina, if you have any final remarks, and then Mickey, if you have any final remarks, that would be great.
Yeah, sure. So we've included several resources to assist you with writing your ECQs. One is there was an attached document that was attached twice in the chat, as well as some helpful resources from OPM on these SES positions, or what SES is all about, as well as the requirements for the ECQs. And just as Lisa mentioned, for those who make it through the interview and final stages of selection, there is support from our offices that will allow you to get some support in writing your ECQs. Additionally, we encourage you all to take a look at those resources on the OPM website and ensure that you are reviewing the job opportunity announcement in its entirety to make sure that any technical qualifications that are required, that you meet those. There is an opportunity for you to review the questionnaire prior to submitting your application. So we encourage you to do that. We also encourage you to apply early so that you have time to make sure that you get all of the required documentation in, as the announcement does close on 11/59, August 9th. Thank you.
Okay, great. Well, I guess I'll be closing us out here. So thank you, Nina, and all of my colleagues here for helping today. And let me just emphasize a couple of things. First off, thank you everyone for joining. Please apply if you meet the criteria and you have interest. Please apply. Hopefully this sparked your interest if you were sitting on the fence. I cannot emphasize enough a few things. One is what an incredible privilege it is for those who haven't worked for the federal government, in particular in an SES role. What an amazing privilege it is to be able to do that. And you will find that working for the people is something that feels very real when you're here, and it's hard to describe, but trust me and trust all of us here that you see on the screen. It is just an incredible sense of responsibility and duty and privilege, as I said, to be able to do these kinds of things on behalf of the American people. Second thing that I would emphasize is you will have the opportunity to hit the ground running here, because from the bottom up, we're building on an organization structure, the Office of the National Coordinator, to now expand it, elevate it to assistant secretary level, that already has a tremendous amount of capacity and skill set that we're now able to expand. So you have the opportunity, you're not building from bare metal, you're building from an organization that's already got tremendous capability, has already got a lot of confidence and visibility across the department, to now take it into new areas and be able to leverage all of that. And the third thing is, from the top down, you've also got the policy priority and the leadership attention that this secretary, this deputy secretary, as represented by Sarah and Aaron here, playing a very active role with us every step of the way, have given this top priority. Government reorganizations don't happen just like that. It takes a tremendous amount of work to make those happen, working with our congressional colleagues, working across the department, and it doesn't happen without the top leadership. So all of that coming together are things that everyone who's interested in this should take to heart as you think about applying for this. They really are tremendous opportunities, and we're really excited about them. And I look forward to working with whoever applies and is able to make through this. Thank you.